Northeastern Institute of Folk Medicine was established on 21st February 2008. It is an autonomous institute under Ministry of AYUSH, Government of India. The institute is spread over an area of 40 acres and is located at Pasighat, East Siang District, Arunachal Pradesh. An area of 16 acres have been utilized in Phase 1 for the construction of administrative buildings, guest house, thematic medicinal garden. The northeastern region of India comprising the states of Arunachal Pradesh, Assam, Manipur, Nagaland, Meghalaya, Mizoram, Sikkim and Tripura are endowed with a rich biodiversity of flora and fauna. And it has a rich and vast heritage of traditional folk medicine practices, remedies and therapies.
Although we had some traditional healers doing a lot of healing practices in different sort of diseases, but scientific validation could not be done in absence of scientists and doctors. But last year, since we could recruit as Ayurveda doctor and scientist, that is a zoologist, and recently a botanist, so we started the scientific validation of some of the practices. So one very interesting practice is of bone setting. One of our healer, Mr. Tokar Basar, he came and claimed before me that he can do some treatment with this sort of bone problems. Then I asked Dr. Imlikumba, our medical officer, Ayurveda, who is an MD in Ayurveda, whether we can go ahead with this traditional healing practice and which can be documented here. Dr. Imlikumba readily agreed. Then since last 6 months we have got 6 different cases. So whenever there is an opportunity, I also used to go and visit the patients. Then I found Mr. Tokar Basar, our this traditional healer, using 3 different types of herbs which are abundant here in the jungles. This has been videographed and then photographically also recorded, and literature has been also prepared by Dr. Imlikumba and the team from Neifm Pasighat.
मेरा जब बचपन से शुरू किया ये चीज़, जो शुरू होने के बाद में तो इतना मैं आदमी इलाज करके आ रहा हूँ. इसका इलाज करते समय में ये चीज़ को भी सोचता भी नहीं था, तो उसको भी हम देखते आ रहा हूँ. उसका बाद मैं जो भी हो हड्डी टूटने वाला करता हूँ, और ये नाभि का प्रॉब्लम, नाभ्स का प्रॉब्लम, फ्रेलाज, जो बच्चा ये नहीं भुगता है इसी को भी करता हूँ.
A person named Genome Litin, aged 20 years, had reported to the OPD of Neifm with a complaint of difficulty in lifting the right hand due to fall while playing volleyball. He had visited the nearest hospital with the same complaint and he was advised X-ray. The X-ray revealed that his right clavicle had fractured. As he was facing some monetary problem, he reported to Neifm for treatment, and this was how he was treated with the help of traditional bone setting practice. Abhishek Mahata, aged 12 years, visited Neifm OPD with the complaint of difficulty and pain while lifting his right hand. He had a complaint of fall in his school while playing. On examination of his X-ray, it was found that his right clavicle was fractured. This was the treatment advised and given in Neifm Pasighat. A male aged 80 years named Panish Mitra had reported to Neifm OPD with the complaint of difficulty in walking and pain in moving his right leg. He had a history of fall from bed while getting up to attend to his natural urges. He had taken an X-ray of his right hip joint, which revealed that he had a fracture of the right femur. As he was very old and didn't want to undergo operation, he visited our Neifm OPD to see if there was any alternative for his problem. This was the treatment advised. 25 years named Premchand Prasad reported to Neifm OPD with the complaint of pain, swelling and difficulty in moving his right leg after he fell from his bike. There was severe swelling and collection of blood in his right ankle. This was the treatment given to him by the traditional bone setters of Neifm. Reported to Neifm Pasighat OPD with the complaint of difficulty in moving his left wrist joint. He stated that while he was studying in Chennai, during his free hours he was playing football and he fell. He was rushed to the hospital and an X-ray was ordered and it was diagnosed as a fracture in the metacarpal bones. His parents brought him home and visited the traditional healer for better treatment. This was the treatment advised to him by the traditional bone setter of Neifm.
Hello, myself Dr. Imlikumba, Medical Officer Ayurveda, Northeastern Institute of Folk Medicine, Pasighat. I want to quote a famous quote by Priscillus which states that the healing does not come from the physician, it comes from the nature. So, the physician should turn to the nature with an open mind. World Health Organization has defined traditional medicine as the sum total of all knowledge, skills, beliefs which has been generated over generations with the aim of healing, not only healing but also diagnosis, prevention of disease with the use of various plants and animal products in warding of preventing diseases. When we see the origin of use of plants as medicine, it can be traced since the start of civilization or since mankind came into existence. Various places, especially Southeast Asia like China, Japan, Greek, Arabian countries and also India were very rich and they have started their own system of medicine which were independent and providing better healthcare facilities. With the invent and the increase in modern medicine, these traditional practices lost its shine. When we look into the use of traditional medicines in different countries, we can see that nearly 40% of population in Japan uses traditional medicines as the first line of treatment. Coming to China, nearly 60% of the population uses traditional Chinese medicines. In India alone, nearly 70% of the population use traditional medicines. Task Force report by Government of India has divided traditional medicines into two groups, that is codified traditional medicines and non-codified traditional medicines. In the codified traditional medicines, AYUSH comes under, and in non-codified traditional medicines, traditional healers, indigenous traditional healers, the person who practice traditional medicines are known by various names all over India like Vaidya, Kobiraj, tribal healers, traditional medicinal practitioners. This study was conducted in Neifm Pasighat and this shows that Pasighat is indeed rich in traditional bone setting practices and ethno-medicinal plants knowledge. People get benefits by the traditional practices performed by the traditional healers of Northeastern Institute of Folk Medicine Pasighat. This is the chief reason for which traditional bone setting practices is still running smoothly with full faith and hopes, even though sophisticated orthopedic treatment are available. Moreover, if systemic evaluation of these healing plants involved in traditional bone setting practices is done, then it will provide a promising scope to the future pharmacological research on modern orthopedic techniques. This will also confer a proper scientific authentication to this practice. I would like to thank Ministry of AYUSH and also to the Director, Northeastern Institute of Folk Medicine, for helping me to carry out this study and documentation. This documentation is just a collection of only 6 cases. In future, a wide variety and also different traditional bone setting practices among different tribes of northeastern region can be taken up. This is just a small step towards a better and bigger vision of Northeastern Institute of Folk Medicine.